Hello, this is Dr. David Gunn, your eye surgeon. In this video, I will explain what a pterygium is, why it forms, and how we treat it. You will have plenty of time to ask questions when we meet in the clinic, but watching this video beforehand will help you arrive well informed. What is a pterygium and how did I get it? A pterygium is a wing-shaped growth of tissue that begins on the white of the eye and slowly advances onto the clear cornea. Think of it as a scar caused by years of ultraviolet light, heat, wind and dust irritating the surface. Queensland's intense UV index, outdoor lifestyle and reflective environments such as water, sand and metal roofing mean we have one of the highest pterygium rates in the world. People who work or play outside without wraparound sun protection are most at risk, although genetics and a dry, irritable ocular surface also play a part. Once the growth reaches a certain size, it can look unsightly, feel gritty, pull on the surface of your eye to induce astigmatism and, in advanced cases, obscure the line of sight. Unfortunately, eye drops, ointments or lasers will not remove a pterygium. Lubricating drops and sunglasses can soothe symptoms and slow growth, but surgery is the only definitive treatment once it is causing problems. How is modern pterygium surgery performed? Deep intravenous sedation is combined with a long-acting local anesthetic block, so you are completely comfortable and effectively asleep, often with no memory of the procedure. While you are asleep, the pterygium is delicately peeled away from the cornea. Much of the tissue is hidden under the surface, like the tip of an iceberg, so we meticulously clear the entire root, even the part wrapped around the eye-moving muscle. A bare area would allow the growth to return, so we harvest a very thin patch of your own healthy conjunctiva from under the upper lid and secure it over the defect. Instead of irritating stitches normally used in pterygium surgery, we use a tiny droplet of fibrin tissue glue. This sutureless premium technique speeds healing, is far more comfortable, and gives a smoother cosmetic result. The fibrin glue is derived from donor plasma, so if you have objections to blood-based products, please tell us. What happens on the day of surgery? You will arrive at the South Brisbane Day Hospital and be admitted by the nursing team. You will put a paper gown over your clothes, meet the anaesthetist and drift off to sleep. The operation itself takes about 30 minutes, but expect to spend 3 to 4 hours at the hospital from admission to discharge. An iPad and shield are placed for the first night, and you will need a responsible adult to escort you home and stay with you. What is the recovery from surgery like? Most patients describe the eye as gritty and watery rather than painful. You will be given a combination of paracetamol and ibuprofen, and this is usually adequate. Vision is misty for several days and the eye can look red for 2 to 3 weeks, though occasionally this can be up to 6 weeks.
When can I drive? Most patients drive comfortably 2 days after the surgery, but ensure you wait until your vision feels safe.
How long do I need to take off work? Most people take a week off after their pterygium surgery, though this does depend on what you do. Office-based work is often possible after 3 to 4 days, whereas for dusty outdoor or industrial work, a full week or 2 would be a good idea. Will the pterygium come back? Thankfully, with modern pterygium surgery, recurrence rates are very low, less than 1 in 1,000. If it recurs, it can be treated with medications or very occasionally a need to repeat the surgery. Long-term, wearing wraparound sunglasses and a broad-brimmed hat is important to reduce UV exposure, which can cause recurrence. Will my vision improve? If patients have severe pterygium that affects their vision, removing it often restores a clear ocular surface and reduces astigmatism. Vision can be a bit blurred for a few weeks and then improves. We will see you 1 month after the procedure to check on your progress in vision. Some patients need a change in their glasses script or very occasionally require more surgery if the vision is still blurred a few months after the procedure. Now let's talk about the risks of surgery. Every operation carries risk, though serious problems are uncommon with pterygium surgery. Pain and redness should be expected for the first few weeks. Rarely the graft edge can be visible or the eye remains red longer than expected. Most of these issues improve with time over a few months. Infection is extremely rare if drops are used correctly and you keep your eye clean, but could be serious if it occurs. Scarring on the cornea is uncommon but could blur vision and may require further surgery. The risk of this is higher if you had a very large pterygium to begin with. Some patients have a large white scar under the pterygium that cannot be safely removed. This may mean that the white patch is still visible, even after the pterygium is gone. Almost all patients experience dry eye symptoms for up to 3 months. This is usually temporary. Double vision is a very rare complication that could occur if deep scar tissue forms around an eye movement muscle. Severe allergy reactions or a complication from the anesthetic block are extremely rare but could be serious if it occurs. Overall, pterygium surgery in Australia is extremely safe, and I am a highly experienced eye surgeon and am specially trained in the latest treatment methods. This video is just a quick introduction to pterygium surgery, and we hope you found it useful. It is a good idea to read through the information brochure and jot down any questions you might have so we can address them together when you meet me in the clinic. Thank you for watching and for choosing Queensland Eye Institute for your eye care. Our team looks forward to guiding you through safe, effective pterygium surgery and returning you to clear, comfortable vision.